Ryan, question.
Yes.
It's bulking season for you, bro. How much weight have you put on in the last, I don't know, 6 months?
I think I peaked out from my lowest to my highest, I think like 27 pounds.
Really?
25, 27 pounds. Yeah.
That's outstanding. I mean, I approached you the other day. I was like, dude, fucking bulking season's looking good on you, man.
Thank you.
Like that's some work.
Yeah.
As he's standing there with his bowl of food, like his 4th bowl of food for the day at 10 a.m.
My salad bowl. Has everyone seen my salad bowl that I fill up 4 times a day? Just
spend an hour and 15 minutes working out and
but it's not a salad.
4 hours a day collectively putting food in the system.
Yeah,
work.
It's exhausting.
Good on you. Yeah, the workouts are looking good too. It's certainly strength's going up. I've been a bit more consistent and trying some different stuff out there myself. And one of the things that I'm feeling pretty good about right now is that I've stayed pretty comfortable. When I say comfortable, I mean with all the injuries that I've suffered and some of the things that I can't fix or can't help, been able to manage through it with working at a fairly high intensity, at least for me at this point.
Yeah.
And I'm continuing to build those things. And there's been a constant check-in, and you were checking in with me the other day, which is why I'm bringing this up. I went, yeah, man, I'm actually feeling pretty good.
Yeah.
And I hesitate to say that, knock on wood, because I've been able to manage things a little bit more. On the same token, I got a text message from a guy the other day. He's like, hey, I just had my rotator cuff repaired, and I'm wondering which red dot program would be the best one for me, to get going. And I was like, okay, man, I appreciate that. Let's have a conversation. So we started kind of talking about it, and it led down this whole conversation of how he had, this was a cumulative issue for him. It wasn't something like an acute injury. He finally needed, he's a law enforcement officer. He needed to have it repaired. He was on the desk for a while he was kind of recovering from it. But we were talking about his process and kind of how this thing led up until ultimately he needed surgical intervention. He's doing great now. Sorry, that conversation had happened a little while ago, but about getting him on the program. But, I talked to him. He's like, yeah, dude, I'm feeling great. Like awesome. I'm right back at it. And the pain that I was having, before, which didn't stop me from doing what I was doing, but it certainly limited me. I'm back to overhead now, full range of motion. My strength is back, and I'm starting to gain more. And I was like, that's cool. And I guess like compared against some other conversations I've had with some people, trainers or coaches here at the gym they've been struggling with clients because their clients have maybe been a little uncomfortable and for whatever the reasons are, ramping programs up. They've been maybe a little less active outside, so they're ramping up the frequency of their sessions, and the intensity of those sessions is starting to go up, and they're canceling sessions, or they're kind of making excuses. There's a little bit of ho-humming, and I don't want to do that, and because they're feeling a little uncomfortable. And then to the extent that they're like, yeah, I'm hurt or I'm injured. And so the conversation today is really about is really centered around like, how do you work through injuries and discomfort, differentiating the two, and not specifically like this specific injury, but more the conversation around like, hey, look, are you injured or are you hurt? How do you know? What are the things that you can do so that you're not stopping dead in your tracks and it doesn't get in front of you? The other thing is like, how to identify it as it's coming on, and what are the signals that your body's sending you, and how do you manage those things? How do you listen correctly, and what steps could you take, kind of thing, to understand things a little bit more. So anyway, managing through injury and or discomfort. So that's the topic for the day. Where do you guys want to start with that?
I think the people's patience when managing pain or injuries or discomfort, I feel like people are so, like you said, like people canceling sessions because they experience some discomfort. I think people's like willingness to take a second and assess the situation. And I think we were talking about with you the other day, so our conversation, like I think you were talking about you're squatting and you're talking about like a knee feeling a little achy, right? And you didn't freak out and go, oh, I can't do anything here. You kind of assess the situations, like what factors could have led up to this. You said you had been riding your bike a lot, and then you're sitting in a car, which that combination of heavy stimulus stress and then being sedentary is kind of asking for probably some discomfort, and even in some joint discomfort. And so you didn't get hasty and go, I need to take everything off, shut it down. I am injured. I have or there's like a mechanism of injury. And so I think the biggest thing like initially is people just willingness, like, let's talk about this. Let's take a second. Let's do a check-in, whether with your coach or with yourself, and really see, like, was there a mechanism of injury? Is there damage? Is there things that some of this can be like a mechanical thing? Like it could even just be things that you're doing. It could be a like stimulus thing. It could be like a load management type of thing. There could be so many factors, but so many people get so quick to jump the gun of being like afraid and not willing to do things and take action. So
yeah, there's another end of that spectrum, which is completely ignoring it as if it doesn't exist.
For sure.
I can't be hurt. I can't have this interrupt my workout time. Just go harder, no days off, don't be a pussy, whatever.
Rub some dirt on it.
Some dirt on it. That's another end of that too. And then there's the in between. And I've been guilty of both things in my time. I've shared this before, like my back I refer to as a dumpster fire. My lumbar spine is a mess, and it's worked up into my thoracic spine a little bit, and it has limited me in terms of some of the things that I know I can do more regularly or frequently, and certainly load management is a big part of that for me. And for a while there, I had kind of just said, I'm not going to put a barbell on my back anymore. It's just not worth it, right? And I did step out of jiu-jitsu or BJJ because the problem just kept persisting, and it was debilitating me. And then it was taking me out of BJJ. It was also taking me out of the gym. So what I found is that I could manage it better in the gym than I could on the BJJ mats. My point in saying that is like, that's something that I have some control over, but there's some things that are way outside of my control. There's some serious orthopedic shit going on there, right? AKA the dumpster fire. But I've also had other times in my life where I've ignored shit, right? And I've just kind of pushed through things. And that is also, that can be problematic in ultimately like leading to other things, up to and including having to take time off or being forced to take time off or really modify things to where I'm miserable. Yeah. Like this sucks. Yeah. Like I can't do what I want to do. So there's both ends of that. I have both labrums in my shoulders are torn. I know this. And after I did the first one and I ignored it, right? And I kind of worked through it and it presented some problems, some longer term problems for me before I had to kind of readdress it. Then I did the other one. And I was like, well, I don't want to make that mistake again. So instead of maybe kind of finding a happy medium, I went to one extreme, which was I'm going to be very, very, very conservative with this thing. And conservative is relative, training history, a mechanism of injury. One was more cumulative, I think. It was maybe something that happened a long time ago, and my ignoring it precipitated larger problems down the road, where the second time it was very acute. I know exactly what I did, what happened, and where and when it happened. And I took a very conservative approach to working around it, and to the extent where I was really babying it. And that presented problems for me. More problems than the first time when I kind of took the other approach. So it's kind of hard to know sometimes, but I recognize that didn't work for me either. And it wasn't about me, it wasn't me being a pussy kind of thing. It was more like, look, I want to try and manage this differently. Yeah. But that level of different that I took it to probably wasn't really productive for me. It led to other things, some serious imbalance in terms of strength. Psychologically and emotionally, there was some imbalances there. And then more, I had to kind of wrestle with that as I was trying to work out my way out of that situation, like emotionally and psychologically, and also physically, like just being frustrated. So I think you mentioned something there about like the fear factor, which is a big driver of all of this. Like, okay, I'm uncomfortable. What is this? I don't know. And to your point, I don't know what it is. And so that creates fear. Yeah. Right. And then that fear drives decision-making process. Right. And I guess the point I want to make here is the most important thing you can do is really check in and understand, like, what is it that you're feeling? And you may not have a large background in, exercise physiology, anatomy, all the kind of things that go into, your workout program, enough to have gotten you some results and keep you healthy and do the things that you want to do. But it can get a little bit more complex there. But one of the things, and I think that's where he started, is like just being aware of what's going on. And your body's going to send you signals.
Yeah.
It's going to tell you. You have to know how to recognize those signals, and then you have to know how to identify what that signal is and kind of where it's coming from. And the same as you would anything else, right? Pain is a learned response, right? It's not something you're inherently born with. You experience it, and then it's kind of downloaded, and the frequency and the I guess the intensity of how those experiences have happened will shape how you deal with stuff. And so some people have dealt with an immense amount of pain. I've dealt with some pretty kind of traumatic stuff, and so I know what like excruciating pain feels like in my head, in my back, in my hip, in my knee, in my ankle, like everything from car accidents to bike accidents to, injuries on the football field, or, in the game of life that I've been through. So like, I understand there's an extreme on one end, and so like, I might be feeling, for me, what's a level 2 could be a level 8 on a scale of 1 to 10 for somebody else, because they don't have those experiences. And I think that's a challenge a lot of people are faced with. And so when you find that comfort zone, like you want to stay there. But if you're on this journey, that's not realistic. Like, because if you're pushing yourself and you're really trying to, to reach new levels of achievement, inevitably the shit's going to come up. So that's why I wanted to talk about it today.
There were some things I was thinking about when you were talking about pain and injury and being able to identify it. And if you're somebody who is new to resistance training or, being physically active, if you've never been in that situation, it's hard. It might be hard to identify, am I in pain or am I creating an injury? Do I have an injury here? So I think some basic questions that you could ask yourself would be, am I feeling this on both sides of my body equally, or am I feeling this discomfort or this pain on one side? And, comparing it, to your point, Ryan, as far as, was there a mechanism of injury? Maybe this person's just really deconditioned, and so they're really fatigued going through certain movement patterns. So is there a different movement pattern that you can take yourself that might be similar, where you're changing the gravity line and those types of things? To see how it impacts your body.
Could you guys define mechanism of injury?
Yeah, sure.
You guys have both said that, so I think that might be
question.
something that's important to get across.
So a mechanism of injury is, was there a specific instance that caused an injury to occur? So let's just say, I like the ACL, for instance. A common mechanism of injury for an ACL injury to occur would be the foot to plant, and then there's a rotation at the knee component, and usually then there's a symptom of a pop or immense amount of pain for an individual. So there's a specific instance that creates then the environment for something to happen.
Acute.
Yeah.
And that can be like contact or non-contact. So there can be a situation like that, or like we even know like a coworker who they football and their like leg literally got taken out, and that mechanism of injury was a contact injury. So
so that's an acute. That's an acute, and there's also cumulative, which I mentioned. So maybe cover that.
So cumulative would be repetitive overuse. So let's take an overhead throwing or an overhead sport, or pressing overhead, and maybe because of what's happening anatomically, skeletally, the way things are aligned or the way the muscles are firing and whatnot, continuing to press overhead with a certain movement pattern can create over time, maybe you end up with biceps tendonitis or rotator cuff tendinopathy of some sort.
Yeah.
And would you say that that's something that comes on gradually as far as the pain itself begins to increase or persist? Like, how do I know when I'm crossing the line from repetitive use into a cumulative injury?
I think generally what happens remember, pain is experienced differently for different people. Maybe at first you just have like a dull achiness at the end of a workout, and then maybe that persists to last more than, a few minutes to a day, or becomes a couple of days, or then you have a hard time being able to lift your arm up just to maybe turn the doorknob on a door, or pick something up and put it in a cabinet, or reach for a cabinet, something overhead. And
Activities
pull it
that
down.
don't usually hurt.
Yeah.
Exactly. It starts to impact your activities of daily living.
Yeah, I think about there's things that come up or have come up for me, and certainly people can relate to that listen to the show and some of the other types of episodes that we do. Like in the firearm space, I spend a lot of time there. I have a lot of friends that are instructors or work on teams. They're in law enforcement. They get paid. They make their living carrying a gun, and so they practice quite frequently. And anybody that's done this knows what I'm talking about. They can relate to this. They've had some kind of a wrist issue or an elbow issue because of the repetitive use associated or the repetitive motions associated with shooting a firearm, whether that's a rifle or a pistol. And those things can be different, right? Because of how you're handling those things, the weight, the ergonomics associated with that. And what generally happens is it starts to show up like you just described. It's kind of this like, hey, my wrist is feeling a little funny today, or I've got this pain in my elbow, and I might not even be feeling it at the time I'm actually doing the activity. It's happening after, right? And it's just like, you can't be bothered with it. And the other part about it is like, I can't let this impact me because I need to get back out to the range in this particular example and practice, or I don't have a choice. I have to go to work, right? And that's one of the things that needs to be, I think, highlighted here is like, how is this impacting you and the other things that you're doing? And are you ignoring it or kind of just olaying it because you do have to maybe, again, these guys are teaching classes every weekend or, during the week, or they're running operations or whatever the case is. They're competing, on the weekends or whatever, and they can't not compete, right? Yeah. So, but at the same time, they're not doing the things in between to, number one, take stock, right, of what is actually happening, what am I feeling, how am I feeling it? Or two, and we can talk a little bit about this, is like, okay, how do I work through this? Like, am I injured? Right? Or is this something what's really causing this discomfort? And that's a differentiation that likely needs to be made. But the point is, on the cumulative side of things, it can show up kind of subtly. And our first reaction is to get that out of our brain, right? Particularly if there's a consequence to acknowledging it. And the consequences could be many. Again, for the guys I was just talking about, like if I have to teach a class and that's how I put money on my table, like the consequence of me acknowledging this pain right now, my discomfort, means it could impact that. That's a very real, that's a valid and legitimate concern, right? Or I can't run, I can't go to work. I can't run this operation, or this could be a detriment to my team. And me acknowledging that means I am a detriment or a potential detriment to my team in some form or fashion. And that's kind of taking it to one extreme. But again, acknowledgement of it means that you have to face it. And so it's much easier to just kind of ignore it or put it in the back of your brain. That's actually a survival mechanism, right? For sure. And that's not something like, whether you want to admit it or not, it's inconsequential. It's what our brains do, right? When we're faced with those kind of things, the first thing our brain will do is like, it will backfile it, and you will try and replace that with something else, like I have to go to work, or I have to do this workout, or my legs are too small, right? And if I don't do the thing, with the knee, the hip, and the ankle, like my legs get smaller and I feel horrible about that, or whatever the case is. It's a weird psychology that happens there, and we don't necessarily have a lot of control over that. Until you acknowledge it and start to face it and work through it, then you can train yourself through that. And that training comes with first acknowledgement and then confronting it with, and again, becoming more aware.
Yeah, and I think like to differentiate even more, like an example of a kind of a day-to-day ache or pain that can come up is versus a cumulative. There we go. Cumulative. I can't say it right now. My brain. A thing that builds up over time. Issue is, for example, like we talked about Scott's knee, where that I don't know all of his history and how he feels from a day-to-day, but from my experience or from what I know with that is that's more of like that kind of day issue, right? Where that he felt some knee discomfort, he didn't freak out, right? But that was something that popped up, and he kind of took note of that, but he didn't necessarily change all of his game plan from there. Where like I've talked about on the pod a couple times, like what was going on with my knee. So I went through that same thing initially. I started to push my leg workouts a little bit more, and I started to just kind of a little bit notice some discomfort during the workout. But then even the day after, I was getting a lot of like swelling, and I was getting a lot of discomfort, and that just kind of slowly built up over time. So it happened the first few times and I kind of took note, but I kind of ignored it of like, okay, this is just something that's happening. Maybe I'm just overworking, things like that. But then when it continued to happen week after week and it would last longer and it would happen every leg day and it would be achy just sitting down, things like that, that's when I knew it was more of a thing that built up over time that needed to be addressed. And so that's where there wasn't necessarily a mechanism of injury where I felt a pop or I felt a tear or I felt a strain. But there was obviously something that it was causing to where it was not just only inhibiting my workouts, but it was kind of inhibiting me in my day to day. And so that's where there needed to be action of like, okay, I need to either figure out what's causing this. I need to figure out, take a game plan of a rehab protocol or take a game plan of things that I can do to help it, or also manage some of my training volume. So it's like a good example of going back to the shooters is there's kind of two things you can do is you can kind of remove a little bit of the stimulus, because sometimes it might be like the person whose knees hurt when they run because they weren't running and they started running 5 days a week. Like that might be a volume issue. But for someone like that who like needs to work or they need to teach their course or that's their job, the other end of things is like they can look at, for example, like their ergonomics or their technique of how they're shooting or how they're drawing, or like the repetitive thrower, right? Like, is there a mechanism of how they're doing that movement pattern that is overstressing or over an overuse injury on a specific
flawed movement? Yeah,
right.
Exactly. Whether it's connective tissue or the muscles surrounding. But then there might also be like a stimulus or a thing that you can provide, like a rehab exercise that might create more capacity in that tissue or that joint or the things surrounding it to give you more ability to handle more volume, handle more training,
better
or
resilience.
Better resilience, exactly. Yeah. So there's kind of lots of different things to consider with that. So,
the other thing is too, as far as, you're talking about somebody that might be shooting in the tissue and maybe it's repetitive overuse motion or something like that. The other thing to think about is what else is happening in your life outside of that event? Because, this isn't related to shooting, but I can tell you when we get on our road bikes, my elbows start to light up and then I start to feel it in the gym. And so it impacts my grip and it impacts my pulling. And so I know it's not necessarily because I do a ton of pulling in here, because I do a lot of pulling, but I also know that the road bike in that position, while I might not be repetitively flexing my wrists and those types of things, but I am holding myself upright in a position that I'm not used to. I do see that translate over. So I would say the other question is, if you are an instructor and you are shooting on a regular basis and all of these things and something does come up, I would take a look at what else is happening in my life that might be contributing to that.
Yeah. Back problems, neck problems, shoulder problems. I think people that are fairly inexperienced a lot of times will relate that directly to the exercise they're doing or maybe not doing. But a lot of times like sleeping, right? And how you sleep, how you're conducting yourself the other 23 hours out of the day outside of the gym is stuff you want to examine to the point of the road bike. Like, okay, well, I'm very conditioned for doing the deadlifts and the pull-ups and the rowing and all that stuff in my pulling, but I'm not conditioned for this. So that's one thing to look at is like, well, what am I doing to, again, to your point, like improve tissue quality for the in the gym, for the stuff that I'm doing outside the gym, strength, mobility, flexibility, all those kinds of things to offset this. The other thing I want to bring to the table is okay, so the symptom seems to be at the knee, as you mentioned a very acute injury with regard to the ACL. But when you look at cumulative things and going back to like your knee, this was maybe a little bit of a different issue, but maybe similar, because I can't remember exactly what your issue was. But you're feeling your knee and you think it's your knee. My knee is injured. My knee is hurt. Okay, your knee is hurting. What is creating that pain? That pain signal that you're feeling there, and immediately going to the site of the pain is not necessarily the answer to your problem. Again, going back to like cumulative things, it could be coming from the hip, could be coming from below the knee, like when we look at the ankle and the foot. And so it's interesting. I won't use his name because if I say it, people will know exactly, and I don't want to give that away. But CC knows exactly what I'm talking about. He's a very good friend of mine, friend of ours. He's in the shooting community, and we spent quite a bit of time, talking about the pain he's been feeling in his knee, right? Which isn't his knee, right? The problem didn't start at his knee. There are now problems at the knee because we're not addressing other things, right? And it's interesting, when you kind of get into that and you really start to, you have to be ready for this. And again, with the acknowledgement and then the reaching back to untangle the sticky web, that the thing that you think it is may not be the thing that it is. This is just the signal you're getting. Your body's telling you this is a problem for me here, but it doesn't necessarily mean that's where the problem originated. Yeah. So being able to, again, untangle that sticky web of what are those issues and where is the issue actually stemming from? What is the root cause? And so what you might find out is, and in this guy's case, he found out by the way, the knee then translated into the back. Mm. But the problem originated at his feet, right? And so when we're starting to look at like the thing that you think you need to work on or want to work on, that's ultimately maybe you're feeling limited by, is not that thing at all.
Yeah.
And so there's, again, with that acknowledgement and that acceptance is like, I might have to do a lot of work on things that are very unsexy to come out the other side of this. And maybe it's not very much work at all, but you have to do that work. And you have to remain consistent with it, because I think part of this is like coming out the other side of it is a lot of people like, oh, I did a little work and I feel better. Good, right? We're feeling better, right? Why? Because we're addressing the root cause. And people are very quick to give up, that work that may be very unsexy because they're feeling better and they go right back into the thing. And then that shit pops up again. Yep. It drives me nuts when he hits me. He's like, yeah, you got anything different for me that I can do? I'm like, no. I want you to do this fucking shit that I told you to do.
And be consistent.
And be consistent with it and don't stop doing it. Like, just keep doing that thing and your problem will likely go away the same way it did last time, bro. Yeah. Kind of thing. So that, as coaches, that's a little bit frustrating, but I'm saying that to the folks out there, like, you have identified pain or discomfort somewhere. What is actually creating that? And again, you might not have depth of knowledge to do that. So you might need to seek stuff outside.
It comes up for me frequently with pain in my knees. As a runner, my knees hurt, and I've identified over time, thanks to CC and one of our coaches who used to be here, that it's my anterior tibialis, it's the front of my calf, and it's my quad that's tight. So when I know that when my knees are aching or my knees feel tight, it's not necessarily that I have a knee issue. It's I do a repetitive sport and my quads get super tight. Yep. And so when I stretch and release my quads, all of a sudden the tension in my knee is gone. All of a sudden my knees loosen up. Yeah. But it took some, I sometimes I get some swelling. I have a little bit today. Mm-hmm. I did a pretty hard run yesterday. My knee's a little swollen, but I know that I don't have a knee injury. My quads are just tight. And so that's something that I have to, and it's something that I have to continue to, because it comes up. I have to continue to stay on top of my quads are tight, my hip flexors are tight because of the repetitive motion.
Yeah, and that's a perfect example of managing like something that is maybe a chronic issue, but it's something that, it's like we go back to the shooter, like some of that might be managing things that, yes, there might be some mechanical thing you could work on or some rehab exercise, but sometimes it's also just managing, if you take a race car out on the track, you got to change the tires and you got to do the maintenance work consistently. Mm-hmm. So some of that is also managing those things exactly like that. So,
it's interesting. There's this client that I was having a conversation with this morning who we all share. And we were talking about doing her hip thrust because she's wanting to work on some glute development. And she was telling me that she's a little hesitant in going up in load and or doing another day of it. So I was telling her the benefits of, why I like to do hip thrusts and how you can do them, a couple times a week and you're going to be fine, so on and so forth. But she was saying that the hesitation is because she's afraid that it's going to hurt her back. And what she realized is that what she is feeling is she's feeling her glutes where they tie in. Yeah. Yeah. Exactly. Yeah. So it's been being patient with that individual, because we've also had the conversation with this individual about progressive overload and challenging herself with a heavier load and stimulus. And because she's one that will, the rep counts, 8 to 12. And so I'm going to do 12 and then I'm done. And I said, we've both had conversations, Jones and I, about, challenging yourself, and think about 8 as being the minimum number and using a load where you're really challenging yourself to get to the 8. Mm-hmm. And then 12 will be the bonus later. Yeah. But it's being patient with your people or being patient with yourself and really checking in. So am I hurt? Am I injured? Or what am I feeling? And then it finally made the connection for her. Oh, those are my glutes that I'm feeling back there. It's not my back.
Yeah. So sometimes it's like that education or that awareness for yourself or your client to like know what that you're feeling, right? So some people that are super novice, like we've had someone like, I don't know, doing a bicep curl and they're like, this hurts, this is painful. Like, okay, well, where are you feeling this? Like in my bicep. And they didn't know that that's like the sensation they're going for. But I want to bring it back a little bit to, someone like we're whoever you're talking about, the shooter. I think it's really common now of feeling this thing pop up, especially something like that, where it's not like a mechanism of injury at the knee, but it's more of like this mechanical issue, whether above or below, of people wanting to rest it and like, oh, I rested, I stopped doing the things that were irritating it. And now it feels better because I've given it time for the inflammatory response to go down, all the pain to dissipate and all that. And it feels better. But as soon as they end up going back to the things they want to do or the task, then the issue comes back up. So the culture of resting, it is very clear both in the rehab world, but also from experience of most of the time, the answer is not to just rest something away.
Stop.
That's just letting the pain dissipate, but that's not going to fix the issue. So sometimes it is doing the boring things, like doing the things to take a step back and fixing the mechanics of the motor pattern you're doing or working on things above and below. And sometimes that can take time. So I've said it again about my knee that took like 7 months for me to rechange some patterning because it was stuff going on with my ankle and my hip and a lot of how my mechanics was in squatting, in addition to managing the tissue right at the knee joint. So being patient of not backing off and thinking then that fixes it and then going right back and spinning your wheels and just doing that over and over again, which I think a lot of the average gym goer does, is they have these things pop up and then they rest and then they feel better and then they, or even like in the physical therapy world, I think some people's issue with that is kind of what you're talking about with your shoulder earlier of regressing so much that thinking that the rehab exercises you're doing were fixing it, but really it was the regression in stimulus, which leads to a regression in your total fitness, your total strength, your total muscle mass, which from a performance or health or psychological standpoint isn't good long-term. So it's like, how do you either keep doing those things and fix the issue while you're doing it or dial back with the intention of still testing the waters to get back to the activity that you're trying to do. So I kind of going back to the first thing I started this off with is patience of being willing to like see how things feel after a few days, seeing how an exercise feels specifically that day, like knowing that your body, for most of us, like it's not that fragile, there's training status, training history, all those different things, but it's your body's not fragile. So testing of, hey, how does this squat feel? How did my body respond? And, even I have a client right now who has a knee issue and they had something pop up and it was painful. And I believe it was painful and there was swelling, things like that. But working through of being patient, of testing the waters, knowing that they're not broken, coming back to some exercises and seeing how your body responds after a few days and being willing to trust that process.
So important. And one of the things to understand there too is if you're doing that diligently with a concerted effort, that you're going to find your threshold likely. Yeah. And that threshold might mean a little setback, right? You may irritate that thing a little bit more again and being prepared for that because it'll likely happen, right? It'll likely happen. So understanding, okay, and this is why tracking and being on an organized program and having consistency is so important so that you can go, I know what I did, when I did it, how much, how little, whatever the case was, so that now you have a litmus for how to adjust appropriately and manage, again, whether it's intensity, load, volume, the different variables that we put into that, so that as you're looking for, you're testing that threshold the next time, you can do so from a more informed position. And so you have to be willing to push a little bit with the understanding, obviously, with a certain level of appropriateness that, it could come up again. It's not gone, right? And remember, in understanding, again, the depth of whatever it is, whether it's cumulative, acute, whatever, how are we fixing this? And fixing is a very broad term, right? Or are we simply doing the things that we need to do to make this better, to give me a better platform to now establish a new threshold, whatever that is, without any preconceived notions or any unrealistic expectations. And I think what happens when people aren't getting that, or because they're not putting in the work, right? They're not being consistent. And what one of the things that came up for me there when you were talking about that is just like how important the foundational movement patterns are, like that we need to be doing this. And as soon as we start cutting them out, or what I'm about to go to next, as soon as we start cutting them out to find the workaround to be able to avoid the feeling that we were feeling, right, is the second you start moving backwards at an exponential rate.
Yeah.
And for as long as you spend time moving backwards, again, ignoring something, or in this case, like not doing a foundational movement pattern with a full range of motion, right, under appropriate amount of load, tempos, things like that, you are now working backwards, whether you recognize that or not. Just because you're not feeling it doesn't mean you're getting better, right? And when that ultimately rears its ugly head because you've done those kind of things, I find it very interesting how quickly people will reach for a crutch, right? Like some type of a prophylactic, or I need a brace, right? I need a
cortisone.
I need a sleeve, right? Yeah, I need a cortisone shot.
Copper fit.
There is a time and place for all of that stuff, for sure. I mean, we got the AT sitting across the table. Like she will tell you, like if there's a return to play plan and we need this person back on the field, the court, the gym, the range, whatever the case is, there's a time and place for that. But that should not be the fix or the answer. It is a part of the return to play process. And we need to be testing the thresholds with and without the help or the crutch that you're looking for. So again, like the elbow sleeve, like there's been plenty of times where I wanted an elbow sleeve for a period of time so I could continue to do the thing, but that didn't take away from the quote unquote maintenance work, right? Or rehab work that I needed to do to get myself out of that. And as a result, I haven't had that sleeve on in over a year, right? I feel way better. And there were times where I was really frustrated, right? And I had to back off. But reaching for something like that, an outside, extrinsic, some type of modality or prophylactic to fix your problem is not the right answer. It isn't the right answer. And so I find it really quick, whether it's a fucking supplement or, a piece of gear or a piece of equipment. We brought up the shooting thing a few times, man. That's the first thing dudes will go to. Like, I suck at this. It's got to be my equipment, right? It's the gun. It's the optic. I need to go spend $2,000 on a new piece of equipment, and that's going to make me better at this. It's not that. It always goes back to the fundamentals. Always goes back to the fundamentals. So again, going back to foundational fundamental movement patterns, like you need to be really good at that stuff. And it's likely, if it wasn't an acute thing, right, that happened, an acute injury, largely probably the bigger part of your problem is those things weren't in line. Like you didn't have your shit squared away. Yeah. So you need to go back to revisiting that. At the same time, going back to the psychology piece, you got to be ready for that, right? And so if you can get your head around that now, like before this stuff pops up, or if you're in that phase right now, you're like, yeah, like I'm not feeling great. Like this thing is really bothering me. I would encourage you don't have to be an expert like on exercise to do this. Go back and look at like, what are the foundational things that you're doing? And are you really putting in the correct amount of effort, volume, stimulus, intensity, all those things to making those things really great? You'd be surprised at how much better you will feel and ultimately perform, if you do that. And along the way, you could be feeling a lot of discomfort while you're doing that and being okay with that. Again, am I hurt or am I injured? So I think the next thing is like evaluating that, like whether it was acute or cumulative. And I think, like everybody's got a different threshold for that. Unfortunately, the higher achiever tends to get deeper and deeper into I've been trying to manage around this. I've been dealing with this pain, this no days off mentality or whatever else. So they get themselves to a point where now you have a lot more work to do than you probably would have had to do at the beginning if we'd addressed this a little bit differently. And I think it's really hard for people to do. On the flip side, the other end of that spectrum is, you brought this up, is like having it stop you in your tracks, which then certainly you're not moving forward. And most likely you're going to be moving backwards from this point that you already are. Is that really the right answer for you? And we see that a lot. The other part is like some other things might come up that aren't like, we've talked kind of like orthopedic type stuff or like joint specific or muscle specific. I mean, people suffer other things, like I know people that have like chronic headaches, right? And things like that. That can be debilitating and it can take you out of your game. It's the same though, like in terms of your process of understanding what's doing that, what's aggravating that. Sometimes exercise can make that stuff feel better. Sometimes it can make it worse. You need to accept this, right? And figure out that workaround. There's other things that come up, that aren't necessarily related to that. Maybe you're having gut issues, right? And that's impacting, the energy that you have or the comfort or discomfort that you're feeling, during, before, or after a workout. Examine this stuff. Don't fucking ignore it. If the body's sending you a signal, it's telling you need to listen to that stuff. And what is it? And don't look to a supplement or some diarrhea tea or, again, like an elbow sleeve to fix a legitimate problem, right? And problems are normal. That's the other thing to bring up here. Like if you're feeling that, you're not weird. Like this isn't unnormal. We deal with that stuff personally. We've already talked about that, right? And all the time. It's a product of the lifestyle we've chosen and the things that we've chosen to do. And it doesn't mean we're doing things wrong. It means we're doing things. And could we be doing them better? Right. So on the other side of that, with regard to like when you're starting to feel that discomfort and you're starting to move through and you're starting to discover this stuff for the first time, not being afraid of it, but checking in, like you said, and then being willing to push yourself, a little bit to the next level to understand what that is. And then at some point also be willing to go like, this is bigger than me right now. I don't know what this is. And where do you go? So what are the steps that you could take to understand, like, is this something I should be training through, training around, or not training at all? And that's where a lot of frustration ends up turning up, because you could go to 5 different people and get 5 different answers, right? Where are you going for your information to understand what it is that you're feeling, why it is that you're feeling it, and how could you feel better? We've talked about this on the show. We just did an episode on this, like the world of information. There's never been more of it, and people are never more confused than they've ever been, right? So I would be careful about that. Like, in where are you going? And what is that person's best interests as compared to yours? And how are you diagnosing those things? And everybody's an expert now. Just look at their Instagram profile. They'll tell you right in there, right? It'll say, they'll put all the things in there for you and you'll know. The point of that being, stop it. Like, be discerning, like look at things with a critical eye and know where to go. So there are different places you can go or different people you can go to help you maybe identify what those things are. And just because your knee hurts doesn't necessarily mean you need to go to an orthopedic surgeon that does ACL repairs all day long, right? That guy's got a specific job, right? Right. And I'm not saying he's going to want to repair your ACL if it doesn't need repair. I'm just saying, like, pump the brakes. Like what are the types of practitioners or professionals that you could go to maybe help you get a little bit deeper understanding, and then help you advocate for yourself if you have to go to the next level. And I think that's an important, and it's a roadblock for a lot of people, and it can either drive you deeper into the hole that you're already in, way deeper than, making sure you're making the right decisions. Don't go to the one person for the one answer that you've already pre-diagnosed yourself with because the Google told you. That's very frustrating for me. When I talk to people, I'm like, they tell me they have this thing. I'm like, cool. Where'd you get that information? Right. And that's an interesting one for me. Yeah. So you're laughing about it because you get it. You want to talk about it?
I mean, just Googling and everyone has a rotator. It's my rotator cuff. I mean, that's probably one of the ones I hear the most. My shoulder hurts. I have a rotator cuff problem. What do I need to do to strengthen it? And I mean, just even with the age of social media, like seeing the random, this one exercise will fix your back pain and just things like that. And just knowing that whether it's pain or injury, there's a lot of complexities to this, and that there's no silver bullet to fix things initially just with that. And it is managing. I mean, there is we're going to always go back to, there is mechanisms and load and all these different things, but a lot of it is lifestyle. And are you stressed, and are you not sleeping, and how's your diet, and how's your hydration? Like, those are all factors. And when you're doing these check-ins with yourself over this continuum of managing or rehabbing, is really just assess, we've talked about the same with like fat loss or muscle gain, where it's these waves, but it should be towards the goal. There are going to be waves and good days, bad days, good weeks, bad weeks, but it should be heading towards the goal, whether, up or down, right? So the same thing with managing pain or injury is keep checking in. Like, it's not necessarily going to be gone one day, but am I continuing to slowly get better or am I continuing to slowly get worse, or is it staying the same?
Be honest with yourself.
Be honest with yourself. And if those answers aren't the answers you want, then that's where you really need to assess like, okay, what do I need to change? Do I need to reach out to a practitioner? Do I need to reach out to a better or a different practitioner? Do I need to look at some of my lifestyle and take notes of those things? But having patience in the process, and that's really just an important thing to remember. So.
Yeah, I think it's having patience in the process, but it's also going back to, Scott, you mentioned tracking, and we talk about tracking in a variety of different ways, whether it's with nutrition or whether it's with your strength training. So if you don't know what's causing the issue, and you're not tracking, then how are you going to know? Whereas if you're tracking, you can reflect back.
Paper trail, yeah.
Exactly. So this is what I did on this day. Maybe it could be this. And then maybe you institute that during your next workout, but not necessarily at a heavier load, at a lighter load. How does your body, and then assess, how does your body feel while you're doing it? How does your body feel the next day? How does your body feel the day after? What other symptoms may you have or not be experiencing? So I think you also have to, it's having that awareness and having that tracking. But as far as then, so you have that tracking mechanism, but then like you said, so where do you go?
Yep.
Who do you resource? Are you going to go to your general practitioner, your regular family doctor for this? I don't know. In my experience, I think that's probably one of the worst places to go. But that's just me and my experience of the people that I've dealt with over, 30 some years. Do you go to a physical therapist?
What would you know anyways?
I know. What do I know? Would you go to a physical therapist? I don't know. Like it depends. It depends on
therapist.
Exactly. So, so where do you go? Do you go to Google? Well, we've just had that conversation as far as Google. So maybe you work with a personal trainer.
Yeah,
I
think the answers that people probably be looking for is, okay, you're right. I don't know. Like, where do I go? How do I know? So here's some tips. First off, Ryan just went down a list of things. If you go to somebody because you're having knee pain and they don't ask you about the things that Ryan just mentioned, well, tell me about your exercise program. Tell me about your diet. Tell me about your lifestyle. Tell me about how you're sleeping. Are you taking any supplements? That kind of stuff. Those are questions that I want my practitioner asking me. And the only people I work with are the people that do ask those questions or I can have that conversation with. And I recognize for somebody that's kind of coming into this for the first time, that's very tough to do because how do you know what questions to ask? But those are things that I want my practitioner in whatever realm I'm working in for my personal health and wellness. And I work with very few of them and it took me a long time to find those people, right? And some of them are sitting at this table, right? But those are questions that a true healthcare professional should be asking you in my mind. So going back to like general practitioners, orthopedic surgeons, physical therapists, they're all usually specializing in one or a couple of things. And maybe they don't generally ask those questions. It's not because like orthopedic surgeons don't ask those questions. Maybe yours isn't, but the ones that I've gone to, right, for the things that I have, we have those discussions. And part of that is advocating for yourself. The other part goes back to the tracking stuff, right? So you're trying to gain awareness and you've got this record of, the things that you've done, whether it's been tracking your workouts, your nutrition, your sleep, all those things. Some people are very, consistent with all that and take a lot of care in doing that for them. Well, what does that do? While you've been trying to gain awareness, you've now just prepared yourself to provide your practitioner with awareness. Right. So that you can you're already preloaded with the answers that that we want them to be asking you, that if you don't have those answers, they're going to have to figure that out. And so are you.
Yeah. I mean, I think that just the parallel that just came to my mind is like, do you bring your records to your accountant before they prepare your taxes?
Dude.
Like, do you bring your paperwork? Do you bring, your data?
Yeah.
And then their job is to interpret that data. But if there is no data, they have to find it. They have to do their own, they should be then asking those questions. But you can facilitate a more productive meeting if you come prepared with some of those records.
Yeah, 100%. It's like taking your car to the mechanic, and they're going to ask you, so what's the deal? It's making a noise. Okay, what kind of noise? Describe it to me. I think the old Amoco commercials used to say it's going ping or crack or whatever it is. Like, okay, that's a start. Great. Like, where is it coming from? When does it happen? Right? Like, when does it happen? Does it happen, when you're sitting still and idle, or when you're going 30 miles an hour, 60 miles an hour, braking? Yeah. What's the deal? Okay, that takes me down to the next path. And then, if that person's giving you an answer and they're saying, oh, this is the problem, and this is how much this is going to cost to fix. Just do this and you'll be fine. I would have questions about that. If the person doesn't lift the hood on the car, right, or get underneath the car, or in today's day and age, if they don't plug that ECU into the, or ECM into the computer, or into the underneath your driver's side to diagnose it, because the computer tells them all the error codes and all the things, like, that's information gathering. So if you need to be able to go prepared, that's going to put you in a much, much better position. And if they're not asking you those questions, they're not doing those things, I would be searching around for somebody that can help you with that. And because there is not, and again, even if you had all that information, you went to 5 different people, you may hear 5 different things. Be prepared for that. And don't take the first thing that you hear as the answer, because I think that's what a lot of people are looking for when they're feeling hurt or injured. I just want the fix. Give me the solution. Well, the solution generally isn't ever one thing, right? When we talk about all the things, there's generally several things that you got to do, and you might take you some time to kind of find that right person to do that for you if you're at that point. I've met chiropractors that are outstanding with this stuff, and they have a very good grasp on nutrition, right? On orthopedics, on soft tissue stuff, all kinds of stuff, right? And I found some that go, just lay down on the table and they'll crack
for 5 minutes,
crack and snap you and send you on your way, and you'll be better. Or I need to see you for the next 5 weeks, 2 times a week. Here's what the bill is, right? I've seen both ends of the spectrum. Same with orthopedic guys, same with physical therapists, same with soft tissue therapists, same with personal trainers or strength and conditioning coaches or whatever else. Try to get yourself with somebody that has aligned themselves with other people, right? If you can do that. That's actually not a hard thing to do, because they generally talk about it. We talk about it all the time. I just did. Like, we have people that we work with. So if you can get yourself somebody like a coach, if you're with a coach, ask them who they work with that you trust, you like, who can make a referral for you. That's a great place. If you're going to see a chiro or a physio or somebody like that works with other allied health professionals that can augment and help them do the things that you need to do, or their patients need to do, that's the person you want to work with. So I don't want to get too far into a rabbit hole here. We have talked about this on the show plenty of times, but aligning yourself with the right practitioner is important. Somebody that can get hands-on with you and isn't giving you necessarily the answer. It's giving you, like, this is what I hypothesize this could be based on my assessment, my evaluation. This could be a diagnosis. And I'm not giving you the answer. I'm giving you a proposed answer that we may walk down, but also understanding that might be only part of the thing, and other things might be discovered down the line, and you need to be ready for that. So anyway, without getting too far into that rabbit hole, I think just injury versus feeling discomfort, knowing when to, kind of pull back the reins a little bit and go, okay, we may need to address this differently. Am I hurt? Like, what is hurting? Why is it hurting? What did I do? Record keeping, all that stuff. Like, hopefully you were able to kind of take away some tips from here to manage through that, because I don't know anybody that does this seriously. When I say does this, is like really getting after their health, fitness, wellness, that doesn't have some type of thing that pops up for them. I just don't know anybody, right? They may not be injured, but they're feeling some discomfort somewhere, right? And they know about it. And a good deal of those people have been down this path or this road before. And I don't think they would disagree with what we're saying in terms of, like, hey, this is a process, and it's not one process for everybody. So whatever somebody's trying to sell you on the internet, about this fix for this problem, maybe it's part of the solution. I'm not saying it's the wrong thing to do, but be cautious about how you're approaching your approach to pain and injury management.
And I'll tell you, the discomfort or pain that you get from pursuing these things is always better than not participating.
Yeah, absolutely. And that word participation, you have to be an active participant in this. Yeah. And that's ultimately going to be the answer for you, is if you're farming this out and expecting somebody else to come up with a solution for your problem and just do it for you, yeah, you're heading down a path of continued discomfort and potentially, taking away from all the things that you're trying to get accomplished. So listen, on that note, like, if there's things that you want to talk about, like, you've got things like, I'm never trying to diagnose somebody's injury. I get questions all the time, like through Instagram in particular, like, I got this shoulder problem.
Yeah.
Yeah. Okay. So, like, what are you doing about it? Well, I think it's this, and I've been told it's that. All right. this turns, like I have 75 other questions for you, right? That said, like I'm willing to go down that path a little bit to try to steer you in the right direction, but I'm never going to sit on the other end of that thing and go, do this and this will fix your problem. Like too often I've overcommitted and say, hey, here's my number, call me on this day and we can talk about it a little bit. And that at least opens up that line of communication, because my drive is to help people find answers to their problems, not to be the solution. I recognize, I said this to Ryan yesterday, we occupy a very, very small part in the larger space. We are not trying to say we have the solutions for everything, but if you need help, if you want a little bit more information or be pointed more in the right direction, you can always reach out to us. It's rdftrainonline.com. There's a contact page there. If you hit us, be specific about what you're looking for. One of us is going to hit you back. So you're likely to get somebody sitting at the table right now. Recognize that sounds like work and you're not putting us out for doing that. We will get back to you. But if you're not doing that, then expect that your problem is probably going to continue to persist. And you're only going to get frustrated with yourself if you've tried different things and they're not working. What do they say? Insanity is continually doing the same thing and expecting a different result. Let's help you get a different result.